My name's Jen Wright. I'm a clinical associate psychologist working within Leicestershire Partnership Trust as part of the Paediatric Psychology team. So I've always had a strong desire to improve access to psychological support for people through the NHS. And with my experience of being an assistant psychologist for several years, drew me to apply. Additionally, I had a break from psychology to go travelling, and whilst away, I really miss working psychologically and therefore wanted to restart and progress on the psychology path. And I was made aware of the new role being developed and was eager to apply. And also, it just sounded like an amazing opportunity to complete a degree, apprenticeship, masters, alongside working in a placement. The clinical associate psychologist role was introduced, in response to kind of nationwide difficulties in recruitment, to support the NHS long-term agenda in meeting the demands, wanting to improve access to psychological therapies. A clinical associate psychologist is a practitioner working within a scope of practice under the direct supervision of a registered clinical psychology supervisor, and we can work autonomously with appropriate support. The CAP role, we're based within psychology teams alongside other professionals such as assistant psychologists, clinical psychologists, family therapists, nurses, we work within a range of healthcare professionals in a diverse number and a variety of services. And our roles, we're skilled in developing psychological formulations, intervention and evaluation. So therefore, the workforce expands the reach of psychology, and the work that we do is flexible, individualised, tailored treatment kind of options. The training is an 18-month course so that entails 3 days in your placement, 1 day teaching and 1 study day. My course was delivered through Exeter University, and as I'm based in Leicester, the training was all online, and the academic component of the course was online. And within that training, we had to have a minimum caseload of 24, where we're providing significant psychological intervention. And over the course of that placement, we're expected to have 12 practice observations and 160 hours of clinical contact. We're also is involved is completing a development plan on how we're going to meet our learning objectives and meet the core competencies of the course. We also, as part of the academic component, we have to complete 3 clinical practice reports, which are evaluated, and we have to complete an evaluation of competency report that's reviewed at midpoint and endpoint. The core competencies for the course include assessment, formulation, intervention, evaluation and research, communication and professional and values-based practice. And I guess they're all kind of meeting the 12 key duties that are set by the Institute of Apprenticeships. Also, at the end of the course, we have to complete an endpoint assessment, and this is an opportunity to showcase our skills and our learning over the 18 months course, and that involves a clinical discussion, a professional discussion, and then 4 stations where we assess kind of assessment of risk, interventions. So CAPs need to register with the British Psychological Society wider Psychological Workforce Register. In order to apply to the register, the course has to be accredited by the BPS. My typical workday is varied. I can have 2 to 4 patients in a day, delivering direct clinical intervention. I might also be involved in initial assessments or initial treatment review if I've been allocated a person from the waiting list. A typical day might also include supervision, reflective practice, and writing care plans and completing risk assessments. So within the CAP role, being a permanent member of the Paediatric Psychology team, I am offered further training in relation to pain or narrative workshops. So there's a definite progression within the team to learn and go into different specialities within paediatric psychology. I know other CAPs that I have worked with have gone on to be team managers or support teaching on other CAP courses, and also CAPs were really involved in the endpoint assessment, in supporting that and facilitating the endpoint assessment. In order for this role, you need to have an accredited degree in psychology recognised by the British Psychological Society, which enables eligibility for graduate basis for chartered membership, or you need to have completed a BPS accredited postgraduate psychology conversion course. Alongside that, you will also need to have experience, paid or voluntary, working within health, mental health, or an education setting. So my supervisor supports with my learning and development. They support with the management of my caseload. They develop my competencies by identifying training needs and provide constructive feedback on my work. They also teach and share resources from their experiences. Role continues to be a developing new role, and so therefore some services are not quite clear on the expectations. I guess some services question what the difference is between a CAP and assistant psychologist, and my answer to that would be the long-term investment by the team in terms of further training specific to the team that you're based in. And I guess another challenge was managing the academic component, the work placement and life. So I find the opportunity for further training and learning really rewarding, particularly being a permanent member of the team. I guess the training is linked to service needs, which is really nice, and kind of you're being invested in as a member of the team. Most importantly, I really find the opportunity to connect and learn from families, alongside knowing that I'm supporting children with healthcare difficulties and helping them to live their life as well as can be. I think that's really, really rewarding for me.